Welcome, everybody, again. Our title of the second chapter of our webinar is Basics of Radiation Protection in Diagnostic Imaging. I am so pleased to introduce my co host, Mr. Omar Alghanmi, Medical Physics Specialist and Radiation Safety Officer. Mr. Omar has strong expertise in radiation physics, dose optimization, and safety compliance in diagnostic imaging. Today, he will guide us through the essential principles of radiation protection and best practices to ensure patient and safety and staff safety. Mr. Omar, thank you very much for joining us. We are so lucky to have you.
Thank you, Mr. Abdulaziz, and I'm very excited to deliver this presentation. I will focus on um, broad concepts, and this should give um, the audience the ability to walk themselves through any situation they might have an issue with. The concept of radiation protection is a very important concept in any field that is related, especially those related to health. We would try to understand the risk and master the safety of this important practice. So we want to first understand what radiation is and what it isn't. So what we are dealing with is the ionizing radiation, which is very different from what we usually deal with. So radiation comes in two main branches: ionizing radiation and non-ionizing radiation. Non-ionizing radiation is similar to the light you see off the screen. This is non-ionizing radiation. It doesn't have the ability to exert enough energy strong enough to knock off an electron off its orbits in an atom. So the mechanism is very simple to identify what ionizing radiation is. Ionizing radiation is the energy, uh, uh, is a packet of energy strong enough to knock off an electron of an atom. Um, why is that important? What does this mechanism do in the body? So this mechanism is able to charge an atom, which can lead to changing the polarity of molecules like DNA, and that would lead to damage in the DNA. We will walk through some of the main branches of damage to the DNA, but this is the main idea. It's strong enough to lead to a change of charge in the chemical environment, which then leads to a chemical change, and we interrupt that. We take that as damage because it's not something the cell is programmed to do. So we have a very important principle when it comes to radiation, which is justification. The principle is very simple: no exposure without a valid reason. Why is this important? Because we consider any exposure to be a risk. So now what we have to do is establish that the benefit outweighs the risk of any exposure. So we must have a clear clinical diagnostic purpose. For example, if a patient, we will go through an example later, but this is the main idea. You don't do an exposure for fun. You don't do an exposure for no reason. You do an exposure for a clear clinical diagnostic purpose, and that clinical diagnostic purpose should have a benefit that outweighs the risk of any exposure. For example, these are two hypothetical scenarios that would clarify the principle of justification. Let's say we have a patient, 25-year-old, unconscious after a car accident, and we suspect internal bleeding. The action we recommend, for example, or the radiologist would recommend, is a full body CT scan. This is comparatively or relatively a high dose scenario for diagnostic radiation. The verdict is that this exam is justified. In fact, it's necessary because the immediate risk of death from bleeding outweighs the small long-term cancer cancer risk from the exposure. Now, the second scenario is very different. It's not justified in this scenario. Let's say we have a patient that is 6-year-old female with a mild cough for 2 days and no fever. If we do an X-ray, a chest X-ray, just to be safe, that would be unjustified because the clinical benefit is near zero. This is likely a viral infection. But children are much more sensitive to radiation because their bodies contain more rapidly dividing cells. So they have a more likely chance to develop issues like cancer or other effects that are due to radiation damaging their cells. Another important distinction that I met some people who don't distinguish between the two, usually from the public. But this is a distinction that we need to understand because we need to understand the risk profile of each modality. So we have X-rays or X-ray machines, any equipment that would need electricity to produce a beam. In that case, if you have a risk from the beam, for example, not shutting off properly or anything like that, you have a kill switch. That switch would immediately terminate the electricity to the device, and that would end the exposure permanently. It would not turn on anymore. So there is no risk after the shutoff button is pushed. Now we have another modality, which is radionuclide. Those are similar to iodine 131, as Dr. Fahad has made an example of earlier. Those are unstable atoms. Some are natural, some are made, and these emit radiation constantly. So the risk profile is different. You cannot shut this off. You must deal with it with two or with three categories: shielding, time, and distance. We will discuss these three uses later, but these are important. You can shield it. There are, I believe, emergency shields which you can put the material in if you don't have any purpose for it after you finish the exam, or you must shield the patient or put them in a room where they can stay until the material runs through their system and is out. Or you can establish distance. So the more distance you have, the less radiation you get and the less risk you get. So the key takeaway here is that you can't catch radiation from an X-ray machine that is turned off, but you can catch radiation from a radionuclide. There is no turn off for that. We must take that in consideration when we establish the plans for treatment. Must have clear pathway for that, for how to use the radionuclide and how to administer it and how to dispose of it. So why do you protect ourselves? What's the danger of radiation? What does it do exactly? When radiation hits a cell, it can damage DNA. The good news is that your body has powerful enzymes that repair this damage constantly. You get damage from the sun as well. It's not restricted to radiation from the medical field. There is background radiation anyway. So our bodies are adapted to a certain level of it. If there is too much, you can risk the damage outpacing the repair, and that would lead to long-term issues like cancer. So what is the risk? Like, is it risky to be a worker with radiation? The answer statistically is no. Radiation work is a safe industry. comparable to working in a library or retail. It is not the general profile, the full profile of risk in radiation work is not high. It's actually very safe. You risk injury from lifting a patient or a needle stick. That's a much higher risk from compared to radiation. So what we need to do is we need to respect radiation, but we do not have to fear it. We need to understand how to handle it and how to stay safe around it. So how do we stay safe? What is the concept that creates safe practice? We have one golden rule, as low as reasonably achievable. We achieve this using the big three principles. These are physical principles. You cannot change them. They are always effective, no matter what. So the first concept is time. Reducing the time of exposure will lead to less radiation risk. Increasing the distance, that would lead to less risk because you have less radiation coming your way. And shielding will also reduce risk because the radiation is filtered or attenuated through the shielding material. Time, same idea. You minimize the exposure duration. In fluoroscopy, you use pulse mode, which similar to how frame rate in screens work. You get a single image that appears every short period of time, like millisecond. Like for example, you get let's say 3 pulses per second. You will see 3 static pictures per second, and that would help you guide the operation. And that is much safer than having the radiation always on, like taken the whole time when you are when you are doing the procedure. We also could rotate staff during long procedures. If the procedure takes a lot of time, the staff needs to be involved inside, very close to the patient. You should already be planning for that and shift the staff, especially those who are at high risk or those that are very close to the patient. I think there is a way to optimize that, and that is essentially the role of the person who is managing the operation. The clock is ticking, the dose is always accumulating. It's a fact. Times go on, and as long as you are in a place where exposure is happening, you will get a dose. It's if it's not essential for care, if you are not needed to be in the close vicinity of the patient or to be involved with the patient, to be in the patient care, it is safe. The safest option is to leave the area and stay behind shielding. If you're, for example, that's an issue that my colleague have raised recently, which is that sometimes trainees stay close to the operation. We don't need them to step out completely, but if it takes a lot of time, they should step back or step out of the room. The next concept is distance. We have a mathematical law that decides what level of radiation is given for different distances. If you step back one step, you get fourth of the dose that you get if you are closer, if you didn't take that step back. If you step back 3 times, you get 1/9 of the dose. So the instruction is very clear. You just need to step back. Even if it seems trivial, it's not. It reduces your exposure by a lot. So one of the most important ideas is scatter. Just because you are not in the primary beam, the beam that exposes the patient, doesn't mean that you are away from radiation. In fact, for staff, the source of radiation, as long as you are not in the primary field, is the patient himself. Scatter happens when an electron enters the patient, it interacts with the patient. This leads to when a photon enters the patient, leads to it interacts with the patient, with the material inside the patient. That would lead to the photon bouncing around inside the patient. When some of it gets absorbed inside the patient, some of it comes out and hits the detector. Some of it actually bounces away from the patient in another direction, in all direction. It bounces in every direction. So that's why you need shielding. You need to wear lid apron if you are inside with a patient and the patient is getting exposed, even though you are not inside the field, because the scattered radiation will hit you. The patient is the source, not the primary beam. If you are outside the primary beam, that's the main idea. Good news, shielding is very effective. There is the idea of attenuation, which means that the intensity drops significantly when you are having a shield between you and the radiation. So radiation doesn't just stop. This is um, this is a physical quality of how the photons interact with matter, but it can be extremely weakened by a lot. For example, in this graph, you see that radiation starts with 100% intensity, but the moment it hits this lead shielding block, it drops significantly, and it ends up being only 0.8 of what it started to be, of what it started with. Every layer of lead reduces the intensity by a specific fraction. This is why even thin lead aprons are highly effective. So I know the weight is annoying and it can be very cumbersome, but it is necessary. You need to wear your lead apron if you are involved with fluoroscopy operations or any interventional radiology operations and you are inside the room with the patient. So some shielding tips. Lead aprons must cover from neck to knee. If it's too short for you, you need a longer lead apron. If it's too long, you are carrying lots of weight and that would affect you in other ways. And it's not very ergonomic, so you need to find a lead apron that fits you, but it's not too heavy. Thyroid shield are essential because the thyroid is very sensitive to radiation. Mobile barriers, like the ones they use in fluoroscopy, especially angiography, these are very useful. It's basically free shielding because you are not carrying any weight. You just put them and work behind them, and that's it. Um, these are very useful. I encourage everyone to use them and be aware of them. One important tip is not to fold your apron. Folding the lid folding the apron leads to cracking the lid. So always hang them up properly. I understand it's heavy, it's annoying. I've been there, and but it's necessary. It's not a luxury. Okay, you might fold it and crack it and then leave it there. Some other colleague might wear it and end up getting more exposure than he should be getting. So just be careful with them. It takes a bit of time and space in your mind, but it's always better to do it rather than not do it. Um, these are the rules that are necessary because we need to monitor your dose. We need to understand your practice, see if your practice is optimized or not, and that you are not getting overdosed. So how do we measure the safety when you're how do we measure your dose when you are working? That would be your TLD badge. Your TLD badge is important because it's the record of what you did and what dose you got. So exchanges. Badges are exchanged quarterly, every 3 months. The process is you submit your old badges to your direct supervisor immediately when asked to do it. This is important because we are suffering from missing badges, and that process is very tedious because we are managing. My colleague who is working on TLD readings, he's managing 3 hospitals, not just one. So we need to be very systematic with it. So just don't forget to do it when you are asked to do so. So badge placement is also very important because we need to understand how the dose is received exactly. Correct placement is critical. Your body badge is worn on the chest or torso. It must be under your lid apron because we are measuring the dose that your organs receive. For the neck badge, if you are assigned one, because this depends on the risk profile. If you are assigned one, that means you are working with fluoroscopy, most likely. So you'd need it. You'd wear it at the collar level and outside your thyroid shield. This is important because we use it to get an approximation and the measurement of the dose to your eyes and your head. Pregnancy protocols, also very important, protecting the most vulnerable. The fetus is very vulnerable to radiation, so we need you to notify your direct supervisor immediately upon confirmation. We will perform the risk assessment and we may issue you a fetal badge. For patients, always ask females of childbearing age, is there a chance you could be pregnant? This is important, and I believe this is the policy of radiology. So I would refer you to them. Yeah, that's it. Any questions? And also, I will send leaflets that explain some of the tips for protecting yourself from radiation to Mr. Abdulaziz, and he will share it with you.
Thank you very much, Mr. Omar, for your very, very informative lecture. I really appreciate your time.
Anytime. We are very glad to communicate with other departments and let them be aware of the risk associated with radiation. Collaboration is very important. We cannot do our jobs without communicating with you, and we would gladly appreciate it if you communicate with us about any questions or any concerns. Thank you everyone for attending.